Welcome, everybody. I'm Charisse from the Central Branch of the Howard County Library System. So glad to have all of you with us today. Welcome to the A, B, C, and D of Medicare, Understanding Health Benefits, where we will learn how to make informed decisions about Medicare coverage. Howard County Library System is so grateful that Jean-Robert Anantua, the CEO of the Small Business Alliance Group, is presenting this important class tonight. Real-time captions are available for this class. You can click the CC button on your Zoom window to toggle them on or off. These captions are automatically generated by Zoom and may contain some errors. Please also be aware that the class is being recorded. I will email all registrants once the recording is posted. I will also post the links that we learn about in the chat, and you can cut and paste those to save them. And I will also provide them in the follow-up email. Check out our classes and events. We have the Essentials of Estate Planning and Elder Law coming up on Monday, December 13th. And I will post the link to that in the chat. We also currently have the Undesign the Red Line exhibit at the Central Branch, and I will post a link to the information on that. So please join me in welcoming Jean-Robert Anantua. He has a BS in Information Technology and additional business and project management training from Dartmouth College and University of Maryland, Baltimore. He's a firm believer in community service and a very active member of the community. Internationally, he has committed time and resources and founded the Build Haiti Foundation to meet some of the pressing needs of Haiti and the Caribbean community. Domestically, he founded the Small Business Alliance Group, which provides support for small businesses, which is the engine of our economy. Among his many other activities, he has served as co-chair of Howard County Local Health Improvement Coalition and has served on the Maryland Governor's Commission on Caribbean Affairs. Furthermore, he was instrumental in creating the sister city relationship between Columbia, Maryland and Cap Haitien, Haiti. He also instituted the Global Leadership Program, which is a signature program of the Build Haiti Foundation that serves as an engine to bring students and professionals together to support his vision for Haiti's development. Among his many accomplishments, he received the Fern Award for outstanding support to the Howard County's economy and community, and the Howard County 2018 Human Rights Commission Award. Again, we are so grateful to have Mr. Anantua here with us tonight, and I will turn it over to him. I will be monitoring the chat if you have any questions or comments, and we will take questions at the end.
Thank you, Charisse. I am so grateful to be here with everybody tonight. And it is really a pleasure to be here because I have foreseen this for a while because in my daily work in the community, I have come across many seniors who have been challenged by the Medicare program. And so that was the reason why I approached the library system to see if we could just help address some of these issues by providing some resources and options to the senior community. So with that, I will proceed to our presentation. So tonight we have our agenda, and as you can see, all the bullet points. We will try to cover all these different pieces of information. And so should you have any questions, and of course you can always follow up with the library folks. And then at the end, you can also, you will also find my information where you can follow up with me as well to get your Medicare questions answered. So what is Medicare? It is actually the largest health insurance program offered by the US government, and it serves more than 66 million people, or 18% of the US population. So Medicare is divided into parts A, B, C, and D. Medicare covers Americans 65 and older, and those who qualify due to a disability. And so once you, aside from being 65, once you are qualified by the Social Security, you have about 24 months to become eligible to apply for Medicare. And at 65, you're eligible for parts A and B if you or your spouse have worked for at least 10 years. And so the part A, in terms of what it covers, provides you coverage for hospital or skilled nursing facility. And the part B covers your medical insurance for your regular doctor's visits and outpatient care. Part C, which is offered by private companies, and that is also typically referred to as Medicare Advantage plan. It covers everything parts A and B cover, plus additional benefits such as dental, vision, hearing, transportation, gym membership, over-the-counter medications, meals after hospitalization, healthy meals, personal emergency response systems, flex cards, etc. And of course, not all plans will provide you with all these different benefits. So there's a certain mix and match that happens, or what you would call plan design. So for each of these private companies that offer Medicare, such as CareFirst or Blue Cross Blue Shields, you also have the Johns Hopkins plans. You also have United Healthcare and many other plans. So again, these plans don't necessarily provide you with all these benefits under a Medicare Advantage plan, but they really try to give you as much as they can and to actually just create competition. And your Part D covers Medicare prescription drugs, and these are also offered by private companies. And so what is the cost for your Part A? And so your premium typically is zero for most people. If you work less than 30 quarters, you could have a premium of as much as $471 per month. That is in 2021. So understand that there's a certain level of adjustment that is made every year in terms of the premium. And so if you work between 30 and 39 quarters, you could have a premium of $259. And again, that's for 2021. You also have a deductible of about $2,370 per benefit period. And a benefit period can be up to 60 days after release from hospital or skilled nursing facility. Other costs, you have $352 per day, and that was for 2020. And that's for days 61 to 90 in one benefit period. You also have $742 per lifetime reserve day in 2021, and which is a maximum of about 60 days. And typically, there's no out-of-pocket limit when it comes to original Medicare. Okay, and what your cost for Part B, typically that has a premium of $148.50 per month. Again, that is in 2021 for most plans, and a deductible of about $203 for the year. And other costs, you have 20% of approved amount for most covered services and excess charges, if any. So again, just to make clear, those with only original Medicare without a supplement or a Medicare Advantage plan would be responsible for about 20% of their medical cost. And as I said, no out-of-pocket limit. And so in terms of looking at your Medicare Part B cost still, so yearly, if you have an income of about $88,000 and you're single, you would have a premium of about $148.50. If you're married, that would be about $176 for the same premium. And so it's really based on your income bracket. That's what really determines how much you pay in premium for your Medicare Part B. And as far as options, when you first become eligible for Medicare, yeah, there are people who really understand the information received in different ways. And so that is typically when you receive, when you're going to be eligible for Medicare, that's when you turn 65, you start receiving a lot of information. It's really based on my research and what I understand the senior community to be facing. Yeah, they are quite overwhelmed with all the information received because can you imagine for us as brokers or agents, we actually have to do the classes every year to really get familiar with the information. So imagine they just send you tons of information and you're looking at it. So you can imagine how overwhelmed people are. And so for those who actually just receive the information, sometimes when they get their card, they may look at it, okay, yes, I'm eligible for Medicare. And then they don't really do anything else. They keep that card. And so they go to their doctor, not really understanding that they need a prescription plan and also needing to have potentially a supplement to address the 20% that Medicare does not cover. All right. And some may say, okay, you know what? Since this one does not offer prescription, they just go out and get themselves a Part D or prescription plan to actually cover the prescriptions. And then really the right way to do it is to either get with your original Medicare, you could get a supplement plan and a prescription plan. So at least the supplement will cover the 20% that Medicare does not cover. And then you will also have your Part D to cover your prescriptions. If you choose not to go that route, you can also go with a Medicare Advantage plan or the Part C. And the Part C, as I mentioned before, it really combines all your benefits, such as your A for hospital, your B for your medical, and your D for your prescription. So having all these in place, then people can more or less feel comfortable with having complete coverage. And on top of that, the Medicare Advantage plans also gives you all these additional benefits that I mentioned before, such as dental, vision, hearing, transportation, and other benefits that can be or mix and match depending on how competitive the plans want to be. Okay. So the one thing that I definitely, I mean, as you can see, there is an asterisk with the original Medicare. So which means there is risk of a lifetime penalty unless you have creditable coverage for prescription in place. So yeah, you definitely want to make sure that you have that, because 63 days after you become eligible for Medicare, if you do not have a Part D plan in place, yeah, you start getting into penalty phase. And so no one wants that, because once you get into the penalty phase, you are going to have that for life. Yeah, it doesn't stop after a certain period or just pay it and then you're done. It's not one and done, it's forever. Okay, so whether you have prescriptions or not, it is important to put that in place if you do not want to be dealing with the penalties. Okay, so and again, your original Medicare, to reiterate, covers your Part A and B. It covers 80% of your Part B expenses. You are responsible for the other 20%, and it does not cover prescriptions and something called maximum out-of-pocket. Okay, there is no limit to your out-of-pocket expenses under original Medicare. On the other hand, your Medicare Advantage plans does have an out-of-pocket limit, and that can vary. I've seen it as low as $3,900 per year, meaning once you reach that out-of-pocket limit, the plan will typically cover 100% of your cost. And so as far as Medicare Supplement plan, sometimes called Medicare Gap, they are health insurance policies sold by private insurance companies. They are designed to help with some costs original Medicare doesn't cover. Original Medicare and a Medicare Supplement policy both pay a share of your covered healthcare costs. A Medicare Supplement policy only works with original Medicare. So you cannot have a Medicare Supplement policy with a Medicare Advantage thinking that one's going to serve as primary, the other one secondary. No, that is not. Agent or brokers are not supposed to sell you Medicare Supplement policy with Medicare Advantage plan. That is illegal. All right, and Medicare beneficiaries may want to consider a Medicare Supplement plan because cost can be more predictable and there is not a specific network of providers you are required to see to receive care. And so as you can imagine, as I mentioned before, you have under a Medicare Supplement plan, you have different plan options that you can get. It's almost all the letters of in the alphabet, but typically it's really plan A, B, C, D, F, and you also have a high deductible plan F for those eligible before 2020, and you also have the plan G and high deductible G. G has been in place, but now the plan G is primarily the one that replaced the plan F for people who became eligible after January of 2020. And the difference between the F and the G is that you put primarily looking at your yeah, if you're looking at, yeah, the difference between the F and the G is the deductible for Part B, which is normally in 2021, that was like 183, if I remember correctly. And so the Plan G, that's the only thing it would not cover typically. And other than that, it would, or also international coverage. That's pretty much just the only difference between the two. And then you also have K, L, M, and N as well. So your Medicare Supplement plans, they are run by private insurers, and this is, they are standardized, okay? Each standardized Medigap policy offers same basic benefits. Medicare doesn't cover your Medigap cost. And of course, cost is really the only difference between Medigap plans, because typically you could pretty much just be looking at for example, Aetna, AARP, Care First, all these different plans. Really, you get the exact same benefits. Cost is really the only difference. Some may be charging you $300, while another one may be charging you $150, or maybe not that low, but let's say $200. Yes, I've seen that, and so it's really important for you to understand that, and then to pretty much just try to save the money wherever you can. And so for the Medicare Advantage plans, and as I mentioned before, this is what combines your A for hospital and B for your medical insurance. You have all of that in one plan. And of course, it usually includes prescription drug coverage. So when it has prescription drug coverage, it is called Medicare Advantage plan with prescription drugs and prescription drugs. And if it doesn't have the prescription drug, you call that an MA plan, just Medicare Advantage plan. And of course, you get all these additional benefits that we talked about before, and you are protected by the maximum out-of-pocket limit, okay? And of course, it is an alternative to just having original Medicare. And so there are different types of MA plans. So you have Health Maintenance Organization, or HMO, which requires you, where a primary care physician arranges your healthcare within the plan's network. So understand that when you select an HMO plan, you have to get care within the network. You only have coverage in network. If your doctor is not in the plan network, you will be responsible to pay all of that out of pocket, not the plan. The plan will not cover that. On the other hand, you have the Preferred Provider Organization, or PPO, plan where you choose any provider, but you pay less for in-network services and more for out-of-network. You have point of service plans, and those are really a notch above an HMO plan, because they do provide you some out-of-network in some cases, for certain situations. And you also have special need plans, or SNP, or chronic SNP, or DSNP. So the DSNP is for people who have both Medicare and Medicaid. So Medicaid is for people with a certain, let's say for low income. And then the chronic special need plan, there are people who have certain disabling conditions. Now, okay, so not all plans will have all these different plans. So if you are looking for something very specific to your particular conditions, yeah, you have to make sure you look at the different plans that may have that option available for you. All right, so the SNP plans, again, they are for chronic conditions like diabetes and people who may have heart problems or diabetes or what have you. So you should check and see if a SNP plan is available in your area. They include all Medicare Part A, Part B, and Part D benefits, and they may also include access to proactive programs focused on supporting your specific conditions. Additional benefits and services targeted to members with special healthcare needs, additional support through increased care coordination. The goal is to help you receive the medical care and support you need so that you will be satisfied with your plan, health status, and quality of life. So now let's get to the prescription. And the Part D is available from private companies contracted by the federal government. By law, all Part D plans must offer at least the basic benefits required by Medicare. Two ways to choose your Part D. You could get it as a standalone insurance plan along with original Medicare, or you pair it with a Medicare Supplement plan. Okay, and you could also get it as part of a Medicare Advantage plan. Other things to consider in your Part D plan is really at what tier your prescription will be covered. So when we talk about tier, we have tier 1 through 5. So your tier 1 is typically your preferred generic. Your tier 2 would be your generic. Your tier 3 would be preferred brand. Your tier 4 would be brand names. And your tier 5, more like specialty drugs. And so understand that when we talk about preferred versus standard, your preferred would be a pharmacy that have a close tie with the plan. For example, if you were looking at Aetna and you wanted to know what would be their preferred provider, CVS. CVS is actually owned by Aetna. And then you also have the Caremark for mail order. Okay, and you also have, as I was saying, yeah, the lower the tier, the less expensive. So typically when you get a prescription from your doctor, you definitely want to make sure that this is something that is, you would prefer to see it covered at a lower tier than a higher tier. And then there is, in terms of the plan, the plans typically have different phases, if you will. So you have the deductible phase, you have the initial coverage phase, and you have the coverage gap or do not hold. For some of you, I'm pretty sure you're familiar with that. And then you have that phase, your annual out-of-pocket. I mean, you get to also the catastrophic coverage. And each one of these phases really dictates what you will be paying, as part of your copay. Okay. And so once you are in the catastrophic phase, for example, you would, the plan would pretty much just be paying most of it, or let's say you are going to be paying the minimum amount possible. Let's say, for example, for your generic, you would probably just be covering something like $3 and change, let's say $3.85. And for your brand name, that would be, let's say, $9 and change. So again, this is the way for the plan to say that, okay, once you reach that particular stage, you've spent enough, and that's where the plan comes in, and then say, okay, yeah, we're going to just help you get cover your medications the rest of the way. All right, so I mean, this is pretty much just a summary of what I just mentioned. The amount for paid for prescriptions depends on the stage where you are, and your dollar limits can change each year. Not all plans have a deductible. Many people never reach the coverage gap. Okay, so I mean, most people, on the average, is you will see people with less than 4 or 6 prescriptions. Okay, so and particularly if those prescriptions are covered at a lower tier, yeah, you will never reach the coverage gap. And then the cycle starts all over again on January 1st of each year. Yeah, so yeah, this is this slide pretty much just really shows you the different phases. So you start with the deductible phase up to $435. Actually, we have, as you know, the plan, the prices goes up. The prices go up every year, and so your deductible is now for 2022 is probably going to be something like, no, for 2021 it's $480, I believe. And then so you can expect it to go a little bit higher again in 2022. Okay, so and then you have your initial coverage, and then you have your coverage gap, where you would typically, the enrollee would be responsible for about 25% of the cost. And catastrophic coverage, enrollee pays greater of 5%, or yeah, this is a little bit outdated. So it's more $9.85 or something like that for brand name, and then $3.60 for generic. Okay. Yeah, so in terms of which plan should I choose? And so for each individual, that's going to be very different. You have to really take a number of things into consideration, and that includes your cost, benefits. You have doctor and hospital choice, because for most people, if they have primary care for 15, 20 years, they don't want to change their primary care. And so a lot of times, if your primary care doctor is not in the network, yeah, you won't be able to see them, or to see them, you will have to just, it will cost you more. Then that can definitely become an impediment in terms of whether you get into certain plans or not. You have your healthcare history, your healthcare future, and also maximum out-of-pocket limit. So when should I enroll? So you have different opportunities to enroll. So of course you have your IEP, which is aging in. That's when you are eligible to sign up for Part A and Part B for the first time. Beneficiaries typically has 7 months to enroll, 3 months before, 3 months, the month of your birthday, and 3 months after your birth month. And so your AEP, which is actually another enrollment period, this is what we have right now, which goes from October 15th to December 7th. So you have until Tuesday of next week if you want to make any changes to your plan to actually just do that. Okay. And you can enroll in an MA plan or prescription drug plan for the next calendar year. So typically your plan, any plan that you get now, even if you were to get it in October, unless you qualify for some other special enrollment where you would typically have a plan that becomes eligible the first of the next month. For AEP, it actually goes, your plan effective date will be January 1st. And then you have OEP, Open Enrollment Period, which goes from January 1st to March 31st. And this is typically for people with MA plan. They can disenroll and return to original Medicare or make changes, from one MA to another. That is Medicare Advantage plan. So you can actually just switch from one Medicare Advantage plan to another Medicare Advantage plan. And then you have your SEP, Special Enrollment Period. This period is based on certain conditions, including moving, having Medicaid, coming off employer group coverage, etc. So, if let's say you move, so understand that plans typically, they are not the same in all zip codes. So you definitely want to make sure that the plan that you have, you currently have, is going to be available at your new address. So that's the reason if you are moving, it is important for you to let the plan know that, yes, you have moved. And if you need to change, they will grant you a special enrollment period just to ensure that you can actually get into another plan or have other options available to you. Okay, so late enrollment penalty. Yeah, so typically, if you have a Medicare Part A, there's no penalty if qualified for premium free otherwise. For premium free, okay? Otherwise, you have a 10% penalty. For Medicare Part B, none if qualified for special enrollment period. Otherwise, you have a 10% for each full 12-month period. Okay, and for your Medicare Part D, you typically would not have a penalty if you, let's say, from the time you become eligible, you get it within the next 63 days, in which case you would not have it. But past the 63 days, yes, you are going to incur a 1% of current national average premium for each month you go without a Medicare Part D plan. And so if you're looking at the average cost of a Medicare prescription plan, yeah, those typically average, I would say, $35 to $40. Okay, so that would be 1% of that. And then, so cumulatively, if you've been, if you've have not had it for, let's say, 5 years, yeah, so you're going to add 1% for each month. So you're talking about 60 months, and that penalty will be with you forever. Okay, and there are, in terms of what are the, what type of assistance is available. Okay, there are many sources of financial assistance, and they include Medicaid, okay, which helps with medical costs for some people with limited income and resources. You also have the Medicare Savings Program, which helps pay premiums, deductibles, co-insurance, and co-payments. And that also for your prescription drug cost. And then you also, you may save on drug costs as well, because there's a program called Extra Help or Low Income Subsidy, which helps pay the cost of Medicare prescription drugs. And most states have a program called Senior Prescription Drug Program. Of course, the name may vary from state to state. And typically, you may see something like 40 something or 40 plus currently could be given to people who are eligible to cover the cost of their prescriptions on a monthly basis. Yeah, so you definitely want to make sure that you use your benefits wisely. And so understand that all plans, all Medicare Advantage plans, they do have they have a list of preventive services that you can do each year without having at zero cost. Okay, so no copay. So that is something to definitely try to take advantage of, because it's definitely better to try to prevent it than having to deal with actual illness. So take advantage of your preventive services. And also, yeah, you definitely want to try to stay in network as much as possible, because otherwise it will add up, in terms of having to, each time you go see an out-of-network doctor. Yeah, you have the option for when you have a PPO plan. Yeah, you have the option to go out of network, but understand that it will cost you extra to go out of network. So that's the reason it's important for you to try to see if your primary care or even your specialists are in network. Okay, and then so you also want to ask about generic or low-tier drugs. That will also help you save some money, because based on our understanding, generic or brand name, they pretty much just have the same ingredients typically. So you don't have to be paying for all the advertising that those brand names do to raise awareness about their products. So yeah, generic in most cases will do. And also using the plan's preferred or mail order pharmacy will also save you some money. And of course, understanding your status in the hospital, that's also will help. All right, so this is actually a special slide, to be more present with the, the environment we're in right now. So as far as COVID-19 is concerned, Medicare covers items and services related to COVID-19. All right, so Medicare also covers FDA authorized COVID-19 vaccines at no cost to you. So if you happen to go to a doctor and then they're pretty much just charging you for these things, you definitely want to make sure that you bring that up and get refunded. It covers all medically necessary hospitalizations, Medicare temporary coverage expansions of telehealth services. You also telehealth allows patients to visit with their health practitioners without leaving home. Medicare covers many telehealth related visits. You talk to your plan to get more information. Your provider can't charge you for office visit or other fee if vaccine is the only medical service you get. The same benefits are also provided under Medicare Advantage plans. Be sure to review your plan summary of benefits. If you believe you were wrongly charged, call your provider. All right, so these are the resources that you have, and Ms. Therese will make these available to you. You can actually just copy them right now if you want, but if you don't want to do that, she will also be sending a follow-up email as she indicated in the beginning of this presentation. Okay. So again, looking at what we have here, we have Center for Medicare and Medicaid Services. You have the information about the Drug Assistance Program. And you have Department of Social Services and State Health Insurance Program as resources. All right. And this is my contact information. Feel free to just write it down. And I definitely want to be a resource to the community, making sure that if you have any questions, let's say you are already eligible for Medicare, or you are going to be eligible, let's say you're turning 65 in a couple of months or so. Yeah, I'm open. Feel free to call me. Send me an email, and I would be more than happy to assist you to help you understand your options and the different plans available. So as I said before, I represent most of the carriers that are available in your area. So I would be more than happy to provide you some orientation and present to you your best options. Thank you very much.
Thank you so much. The one question that we did have, you have addressed the differences and advantages between a Medicare Supplement and a Medicare Advantage plan. I don't know if you have any additional tips about how to choose between the two.
Yeah, so looking at, let's say, for example, for those people who typically go for Medicare Supplement plan, and so understand that a Medicare Supplement plan is going to be the more expensive option. So once you go with a Medicare Supplement plan, you are pretty much just buying all the different benefits that you want a la carte, meaning the Medicare Supplement will typically cover just the 20% that Medicare doesn't cover. Okay, so as far as your prescription, you have to buy that separate. For your dental, for your vision, for hearing, and any of these other benefits that you see is flooding the airwaves, yeah, you don't get that under a Medicare Supplement plan. So typically, your benefits with a Medicare Supplement plan is that it's very portable. So anywhere you go in the country, you are able to take that to any doctors that accept Medicare will take your Medicare Supplement plan. On the other hand, when you look at Medicare Advantage, the Medicare Advantage plan Of course, it gives you all these additional benefits. It brings everything under one plan. And believe it or not, a lot of times you have many of these plans available at zero premium. Okay. And this is typically covered by your tax dollars that you have been. I mean, if you look at your Medicare, at your pay stub, if you're still working, you will see a Medicare tax that you've been paying all your life, all your working life. Okay, so that is the difference. But again, Medicare Advantage still can give you that same options to go see any doctor as well if you have a PPO plan. Your PPO plan gives you typically access in network as well as out of network. Okay, so that is the real difference. So if you're on a strict budget, which most seniors are, you certainly want to give Medicare Advantage a strong consideration, because a Medicare Supplement will typically cost you, let's say on the average, $150 for the Medicare Supplement plan. Let's say you get a plan G or plan F. Yeah, that would cost you, depending on your age, that will cost you about, let's say on the average, $150. And then you still have your Part B premium as well, that you pay about $150 for that every month. All of a sudden, you're already looking at $300. You also have your prescriptions. You also have, most people want to have dental and vision. So before you know it, you could easily be looking at 400 plus, if not more. Okay, so yeah, it is true that your out-of-pocket is more predictable with a Medicare Supplement plan. However, a Medicare Advantage plan, particularly if you're healthy, let's say you do your annual checkup and maybe another visit, yeah, you can definitely save quite a bit with a Medicare Advantage plan, because that not only a lot of them have zero premium, but it also gives you all these additional benefits that are incorporated in the plan.
We have another question about the coverage gap. Does being in network only apply to Advantage plans? And can you switch back and forth between original and Advantage, and how do you do this?
Yeah, you can go back and forth between Advantage and Supplement. However, if you choose to go to, let's say you are in the Supplement and then you want to try a Medicare Advantage, they typically give you a one-time opportunity to leave your Medicare Supplement plan and go into a Medicare Advantage plan. So really, it's really trial. So you have a one-year trial. And if, let's say, at the end of that year, you decide that, you know what, I think I like my Medicare Supplement better. So yeah, you will be able to go back to your Medicare Supplement plan after 1 year of trial. Again, that is only a one-time thing. Otherwise, if let's say you want to leave a Medicare Advantage plan to go to Medicare Supplement plan, yes, you can do that, but you will be underwritten by the insurance company, meaning that they will look at your health status and to see if you present a high risk, and that is a difference, really.
Now, what about the issue of what is covered by the various different Part D plans? if you know that you're on certain medications,
Mhm.
how do you research that? And I've heard people say that they've paid for a Part D plan and then they end up having to change because their medications come off the list. Can you talk a little bit about that?
Yeah, so that is the reason before you get into a plan, if let's say it is important for you to get all your medications covered, I mean, as a broker, that's actually the very first, one of the first thing I do. I would pretty much just look at making sure your primary care is in the plan being considered, and as well as your prescriptions being covered. So yeah, you can pretty much just run that across and making sure that they are covered before you transfer. And also one very important resource available, you also have Medicare.gov, okay, where you can actually just put in your basic information and then get an idea of what the plan will cost. But again, for typically, as we know, seniors are not tech savvy generally, so it can be very tasking for some. And so that's the reason it could be beneficial to work with a broker or an agent like myself.
Are there any other questions, anyone? I'm watching the chat here and the questions. Now's the time to ask any other additional questions that you have. Okay, well, thank you very, very much. This was so informative. I will be sharing the information you provided and the links that you provided. And I did put all of your contact information in the chat, so please feel free to reach out directly to Mr. Anantua if you have additional questions. And again, thank you everyone for joining us tonight.
Thank you very much. It was a pleasure being with you. And again, if you have any questions, don't hesitate to reach out. I would be more than happy to assist you. You have, if you're contemplating making any changes for this year, you have a deadline again of Tuesday, December 7th. And that is the deadline by which you can make changes for this year with plan effective date January 1st. Okay, with that, I bid you farewell and looking forward to hearing from you. Take care. Bye-bye.